Welcome to the Deep Dive. Today, we're tackling a topic that unfortunately touches the lives of many pet owners, meningiomas in cats and dogs.
That's right. These are tumors that develop in the meninges.
Those protective coverings around the brain and spinal cord.
Exactly. And our mission today is to really get to grips with these tumors. Understand what they are, how they affect our furry family members.
And, importantly, what the options are for diagnosis and treatment.
Precisely. We've gathered information from a comprehensive veterinary resource that focuses specifically on canine and feline meningiomas.
Okay, great. So let's jump right in. What exactly are meningiomas, and why should we, as pet owners, really be aware of them?
Well, at their core, meningiomas are tumors that arise from those meninges. Think of them like strong protective layers surrounding the very delicate brain and spinal cord.
Okay.
In both dogs and cats, the most common place we find them is over the cerebrum. That's the main part of the brain responsible for thinking, movement, that sort of thing.
And they're common.
They are. What's really key here is that meningiomas are actually the most frequently diagnosed brain tumor in both dogs and cats.
Wow, the most common.
Yeah. And for cats, specifically, they're also the second most common tumor we find in the spinal cord, right after lymphoma.
Okay, most common brain tumor. That really puts it into perspective.
Yeah.
So how do these tumors actually cause problems? What's happening physically?
Good question. So these are primary tumors. They start right there in the meninges from specific cells called arachnoid cap cells.
Okay.
Now, there's a bit of technical jargon, but the location is really important. They're described as intradural extramedullary.
Meaning?
Okay, imagine the spinal cord is like a pipe, and the meninges are layers of wrapping around it.
Got it.
These tumors grow within one of those outer layers, the dura mater, so they're inside the wrapping, but they're pressing on the pipe, not actually inside the pipe itself, the spinal cord tissue.
Ah, okay. So they're pushing on things.
Exactly. Usually we see them as a single lump, a solitary mass, but cats are actually more likely than dogs to develop multiple meningiomas at the same time.
Interesting. Are there other ways they can show up besides just a single lump?
Yes, although it's less common, particularly in cats. In dogs, we sometimes see them spread out more, sort of like a plaque, often along the base of the skull. And they can also pop up in slightly less typical spots, like around the nasal passages or even behind the eye retrobubularly.
Okay.
But wherever they start, the neurological problems we see, they really stem from that slow, steady compression of the nearby brain or spinal cord tissue as the tumor grows.
Right, the pressure.
Exactly. And that pressure often causes what we call vasogenic edema.
Edema, swelling.
Yes, swelling due to fluid leaking from blood vessels in the area. Less often, it can also block the normal flow of brain fluid, leading to obstructive hydrocephalus.
Fluid buildup in the brain.
Right. Or even cause an infarction, which is basically tissue death from lack of blood supply, like a stroke.
So they're not necessarily spreading aggressively like some cancers, but it's the physical pressure that's the main villain here.
Precisely. And here's a really important difference between dogs and cats. Most meningiomas, if you look at the cells under a microscope, are what we call cytologically benign.
Benign, meaning not cancerous in the typical sense.
Correct. The individual cells don't look aggressively malignant. However, and this is key for dogs, these tumors tend to be more invasive.
Invasive? How so?
Think of it like a weed. The individual cells might not be dividing wildly, but in dogs, this weed often puts down roots that grow into the surrounding soil, the brain tissue itself.
Ah, okay. So even if the cells themselves look benign, the way it grows is problematic in dogs.
Exactly. It makes complete surgical removal much harder and means they're considered biologically malignant unless you can get every last bit out. Cats, on the other hand, tend to have tumors that are more clearly defined, less invasive. They don't usually infiltrate the brain tissue as much. And this difference is a major reason why the prognosis, the outlook, can be quite different between dogs and cats.
That's a really crucial point. Now, you mentioned they're the most common brain tumor. Do we have numbers? How prevalent are they?
We do. The overall reported rate for all brain tumors is about 14.5 cases per 100,000 dogs.
Okay.
And quite a bit lower in cats, around 3.5 cases per 100,000.
Right.
But when you look just at meningiomas, they make up roughly 22% of all those brain tumors in dogs.
Still significant.
But in cats, it's much higher, about 59%, nearly 60%.
Wow. Almost 60% of feline brain tumors are meningiomas. That's huge.
It is. So, if your vet suspects a brain tumor in your cat, Statistically, there's a very good chance it's a meningioma. And the good news, as we'll get to, is surgery can often work really well for them.
That is good news.
And interestingly, about 17% of cats with a brain meningioma will actually have more than one.
Multiple tumors.
Yes. Now, meningiomas in the spinal cord are less common than in the brain for both species. They account for only about 14% of all meningiomas found in dogs and just 4% in cats.
Okay. So primarily a brain issue, especially in cats, percentage-wise. It really sounds like a significant concern, particularly for older pets. Does age play a big role?
Oh, right.
And are certain breeds more susceptible? What can the signalment tell us?
Yeah, age is definitely a factor. In dogs, we typically see these in older animals, usually over 7 years old. The median age is around 9.
But not always.
No, not always. They can really occur at any point. We've seen them in puppies as young as 11 weeks.
Yeah.
Right up to, 14-year-old dogs.
Goodness. Any breed links?
Yes, certain breeds do seem to pop up more often. Boxers and golden retrievers are the most commonly reported.
Okay.
And there's some evidence, maybe not definitive, but suggestive, that dolichocephalic breeds dogs with long heads, like collies or greyhounds,
Right.
might have a higher risk for meningiomas in the brain, whereas mesocephalic breeds those with medium heads, like labs, might have a slightly higher incidence of the ones found around the nasal sinuses, the paranasal ones.
Interesting difference.
We also see a slight tendency for female dogs to be more affected than males. And just to mention, there are variations like cystic ones with fluid pockets, and even a rare aggressive type, a spinal meningeal sarcoma, found in a very young Rottweiler pup.
That's quite a range. What about cats? Is it similar?
Similar in terms of age, yes.
Yeah.
Predominantly older cats, usually over 9 years. The average age is around 12.
Wow, 12.
But again, a huge range cases reported from just 1-year-old up to an incredible 24 years.
24. Amazing. Breed predisposition in cats.
No, unlike dogs, we don't see any specific breeds that seem particularly prone in cats. But there is a slight male predisposition in felines, opposite to dogs.
Okay, so older age is the main common factor across both. Now, the crucial question for owners, what signs might they actually see? What should ring alarm bells?
This is key, but the signs can vary quite a bit. It really depends on where the tumor is located, brain or spinal cord, and how much pressure it's putting on things.
Makes sense.
Usually the signs develop gradually. You might notice subtle changes over weeks, maybe even months.
Slowly progressive.
Typically, yes.
Mm.
However, they can sometimes appear more suddenly. Perhaps if there's bleeding into the tumor or a rapid increase in that swelling, the edema we talked about.
Okay.
We often see what are called lateralizing deficits.
Meaning affecting one side more?
Exactly. Symptoms are more noticeable on one side of the body than the other. But it's also important to remember that sometimes if there's increased pressure inside the skull generally, or brain swelling, or even the brain shifting position slightly,
Right.
it can make it tricky to pinpoint the exact tumor location just based on the signs alone. The effects can be more widespread.
That makes sense. Are there any typical patterns in how the signs progress over time?
Yes. Sometimes you might see a long period where the pet shows only very subtle, maybe vague changes. Their body is trying its best to compensate for the growing tumor.
Kind of masking the problem.
Kind of, yeah. Then, as the tumor gets bigger and those compensatory mechanisms just can't keep up anymore, you might see a relatively rapid worsening of the signs.
Oh.
Now, if we look specifically at brain meningiomas in dogs, late-onset seizures are often the first and most obvious sign that owners pick up on.
Seizures starting in an older dog.
Exactly. That's a big red flag. In cats, though, it's often different. Changes in behavior and mental state are more commonly the first things owners notice.
Like what kinds of changes?
Things like just being more lethargic, less interested in their surroundings, maybe a reduced appetite, or even refusing to eat altogether. Those can be early clues in cats. Seizures can happen, but they're less frequently the first sign compared to dogs.
Okay, so behavior changes in cats, seizures often first in dogs. What if the meningioma is in the spinal cord instead?
Right, intraspinal. In that case, the most common signs are usually neck or back pain, depending on where along the spine the tumor is located, of course.
Pain in that area.
Yes. And owners might also notice a progressive loss of coordination, ataxia, and weakness in their pet's limbs. They might even notice it gets worse after exercise.
Progressive weakness. So the signs really can be quite diverse. If an owner brings in a pet with some of these concerns, what would a vet be looking for during the physical and neurological exam, specifically for a suspected brain tumor?
Great question. If we suspect a tumor affecting the cerebrum, the main part of the brain, we look for things like changes in behavior or mental alertness. Maybe the pet seems confused or dull.
Okay.
They might be circling usually towards the side of the lesion or pressing their head against walls or furniture.
That pressing, yeah, I've heard of that.
Also, seeming to ignore things on one side of their body, we call that hemineglect. Vision loss in one eye, weakness on one side of the face, maybe reduced sensation to touch on one side of the face or body.
Okay.
And those conscious proprioceptive deficits, difficulty knowing where their paws are when they're standing or walking. And of course, any history or presence of seizures.
That's quite a list for the cerebrum. What if the tumor is deeper, maybe in the brainstem?
If the brainstem is involved, that crucial connection point, we might see altered consciousness, maybe stupor or even coma in severe cases. An abnormal way of walking, gait abnormalities,
Uh-huh.
proprioceptive deficits again, and cranial nerve deficits, usually on the same side as the tumor. These nerves control things like eye movements, facial expression, swallowing. So you might see facial paralysis, difficulty swallowing, abnormal eye position.
Affecting specific nerves.
Yes, nerves 3 through 12. And also central vestibular signs, problems with balance, head tilt, nystagmus, which is involuntary eye movement.
Okay. And the cerebellum, the coordination center.
Right. With cerebellar involvement, you look for ataxia, that lack of coordination, but often without weakness. Dysmetria is common, where movements are exaggerated or misjudged, like overstepping.
Just stepping kind of movements.
Sort of, yeah. Also, intention tremors, tremors that appear or worsen when the animal tries to do something specific, like reach for food, swaying of the trunk, maybe a wide-based stance for balance.
Mm-hmm.
And often a lack of a menace response. They don't blink when you move a hand quickly towards their eye, even though their vision is fine and other eye reflexes are normal.
Fascinating how the location dictates the signs. What if it's around the eye, in the orbit?
Good point. If the tumor is in the orbital region, you might see the eyeball protruding, that's exophthalmos, swelling around the eye. In severe cases, the eyeball might even prolapse forward.
Oh, my.
Blindness in that eye is common, and when the vet looks at the back of the eye with an ophthalmoscope, they might see abnormalities in the fundus.
So the exam findings can really help localize where the problem might be.
Absolutely. They paint a picture.
And for the spinal cord tumors, the intraspinal ones, what would the exam focus on?
For those, the vet might find pain when they gently palpate or press along the spine near the suspected locations.
Spinal pain.
Yes. And they'd also likely observe ataxia and weakness, specifically in the limbs behind the level of the tumor on the spinal cord. So if it's in the neck, all 4 limbs might be affected. If it's in the mid-back, just the hind limbs.
Okay, that makes sense. It really drives home the importance of a thorough neurological exam. Now, we've talked about where they come from and who gets them, but why? What actually causes these tumors to develop? Is it known?
That's the million-dollar question, isn't it?
Yeah.
In most cases, the exact cause is, well, uncertain. We just don't know.
Frustrating.
It is. However, there has been a suggested link, specifically in young cats, with a rare inherited metabolic disorder called mucopolysaccharidosis type I.
Okay, a specific genetic condition.
Right, which suggests that maybe in some specific situations, genetic or metabolic factors could play a role. But for the vast majority of dogs and cats that develop meningiomas, the underlying trigger remains a mystery.
Yeah, that seems common with many cancers. Okay, so if a vet suspects a meningioma, based on the history, the signs, the exam, how do they confirm it? What are the diagnostic steps?
Well, diagnosis is really a process of elimination combined with getting a good look at the lesion. First, we need to consider all the other things that could cause similar neurological signs, the differential diagnoses.
Right, rule other things out.
Exactly. We need to think about metabolic problems, toxins, other types of tumors, primary ones starting in the brain or spinal cord, or secondary ones that have spread from elsewhere.
Like metastatic cancer.
Precisely. Also, inflammatory conditions like GME, granulomatous meningoencephalitis, nerve sheath tumors, gliomas, lymphoma, infections like fungal disease. Lots of possibilities.
So how do you sort through all that?
Advanced imaging becomes absolutely critical here. It's the key to differentiating between these possibilities.
Before we get to imaging, what about routine blood tests? Do they help?
Generally, no, not directly. Standard blood work, the CBC, chemistry panel, urinalysis, these are usually normal in pets with meningiomas.
Okay.
They're still important, of course, for checking the pet's overall health, especially before considering anesthesia or major treatments, but they don't typically point towards the tumor itself.
Right. So imaging is king. Which type is best?
MRI magnetic resonance imaging is really the gold standard. It's the preferred method for looking at both brain and spinal cord issues like this.
Why MRI? What does it show?
It gives incredible detail of the soft tissues. Meningiomas on MRI often have a characteristic appearance. They tend to look bright on certain image sequences called T2-weighted images.
Okay.
On other sequences, T1-weighted, they often look similar in brightness to the normal brain tissue before contrast, but after injecting a contrast agent.
Like gadolinium.
Exactly. They usually show strong and uniform enhancement, meaning they light up brightly.
That helps them stand out.
Definitely. And another really characteristic finding is that they usually have a broad base where they attach to the dura, that outer meningeal layer we talked about.
Right, the wrapping.
Yes. And often we see what's called a dural tail. It looks like a little tail of thickened, enhancing dura extending away from the main tumor mass. That's quite suggestive of a meningioma.
Oh, dural data. Okay,
Yeah.
so MRI is ideal. What about CT scans?
CT, computed tomography, is another valuable tool. It's maybe not quite as detailed for soft tissue as MRI, but it's often more available and sometimes faster.
And what would a meningioma look like on CT?
On CT, they often appear as well-defined masses that also enhance pretty uniformly with contrast, similar to MRI. CT can be particularly good at showing bony changes, like hyperostosis.
That thickening of the skull bone near the tumor.
Right. Or sometimes if a tumor has calcified areas become hard with calcium deposits, CT can pick that up well. Calcification is actually seen a bit more often in cat meningiomas than in dogs.
Okay, so CT has its uses too. What about older techniques like basic X-rays or myelography?
Standard skull X-rays, or CT as we said, might sometimes show that bone thickening or calcification. But regular spinal X-rays are usually normal if the meningioma is inside the spinal canal, though they can help rule out obvious bone problems like fractures or bone tumors.
Makes sense. And myelography?
Myelography is an older technique. It involves injecting contrast dye into the space around the spinal cord and then taking X-rays.
What does that show?
It can show an outline of the spinal cord and reveal if there's a mass compressing it. With an intradural extramedullary tumor, like a meningioma, it typically shows the contrast column being blocked or deviated by a mass that's inside the dura but outside the cord itself.
But it's not as specific as MRI.
No,
Yeah.
not nearly. There's a finding sometimes called a Gulf T sign on myograms that can be seen with both meningiomas and nerve sheath tumors, so it often can't definitively tell them apart without getting a tissue sample, a biopsy. MRI is much better for characterizing the mass.
Okay, so imaging gives a strong suspicion, often a presumptive diagnosis. Are there other diagnostic procedures sometimes used?
Well, CSF analysis looking at the cerebrospinal fluid isn't done as frequently, mainly because MRI gives us so much information.
Right.
But if it is done, the CSF might be normal or it might show elevated protein levels. Sometimes there's a mild increase in certain white blood cells. But again, it's not specific for meningioma.
And you have to be careful.
Absolutely. It should really only be considered after imaging, and it's generally contraindicated, not recommended, if there's any suspicion of increased intracranial pressure because of the risk of causing brain herniation when you remove the fluid.
A serious risk.
Okay.
What about EEG, brainwave testing?
An EEG, electroencephalogram, can be useful. It might show abnormal slow wave activity, which indicates general brain dysfunction, or it might show specific abnormal electrical patterns called epileptiform discharges, if the animal's having seizures related to the tumor.
But the definitive diagnosis?
The only way to be 100% certain it's a meningioma and to determine its grade or specific subtype is through a biopsy, getting a tissue sample.
How is that done?
It can often be obtained during surgery if the plan is to remove the tumor anyway, or, for brain tumors especially, sometimes a CT-guided needle biopsy can be performed as a separate procedure.
Okay, so biopsy confirms it. We have the diagnosis. What comes next? What are the treatment options for our pets?
The best treatment approach really depends on a lot of things. The tumor's location, size, grade if known, the pet's overall health, age, any other concurrent diseases, and importantly, the owner's goals and resources.
It's a personalized decision.
Very much so. Supportive care is always crucial. Some animals might need to be hospitalized initially, especially if they're dehydrated, not eating, very unstable on their feet, or having severe or frequent seizures.
Stabilize them first.
Exactly. Then, surgical excision removing the tumor is often considered the treatment of choice, the most definitive therapy. And it can be very successful, particularly if the tumor is in an accessible location.
Especially in cats, you mentioned.
Yes, surgery is often very rewarding in cats because their tumors tend to be less invasive and shell out more easily. Complete removal is less common, or at least more challenging, with those more invasive brain meningiomas in dogs.
Right.
It can also be tricky with spinal meningiomas in cats sometimes. And with any tumor located on the underside, the ventral aspect of the spinal cord just harder to get to.
Okay. Surgery is a major step. What if it's not possible, or if the surgeon couldn't get the entire tumor out?
Then we look at other options. Radiation therapy is a very important one. Typically, we use what's called fractionated conventional radiation therapy.
How does that work?
It involves giving smaller doses of radiation over a series of treatments, usually daily for several weeks, maybe 15 to 20 treatments over 3 to 4 weeks.
And when is it used?
It can be used after surgery, if the removal was incomplete, to try and zap any remaining cells, or it can be used as the primary treatment if surgery isn't an option. Maybe the tumor is in a really difficult spot, or the pet isn't a good surgical candidate.
Or if owners prefer a less invasive route.
Exactly. And there's good evidence, especially in dogs with both brain and spinal meningiomas, that combining surgery with postoperative radiation significantly improves survival time compared to surgery alone. It helps prevent or at least delay recurrence.
Does radiation work well for cats too?
Feline brain meningiomas are generally thought to be quite sensitive to radiation. However, we have a bit less published data specifically on radiation for cats, probably because surgery alone is often so successful for them.
Got it. Now, we hear more about newer radiation techniques too, like stereotactic radiosurgery, SRS.
Yes, SRS is a really advanced technique. It uses highly focused beams of radiation to deliver a very high dose very precisely to the tumor, while significantly minimizing the dose to the surrounding normal brain or spinal cord tissue.
So fewer side effects.
That's the goal. Because it spares more normal tissue, it often leads to fewer side effects. And it allows for a much shorter treatment course, sometimes just 1 to 5 sessions, often done on an outpatient basis.
That sounds appealing.
It can be a great option, especially for tumors that are well-defined and perhaps not suitable for surgery. It's often best for patients who can be stabilized medically, say with steroids, beforehand. SRS has been shown to be effective at slowly shrinking meningiomas over time.
Is that different from something called IMRT?
Yes. Sometimes another technique called hypofractionated IMRT, which might be delivered in, say, 3 to 5 treatments, gets confused with SRS. While IMRT is also advanced, SRS is generally considered even more precise in its targeting.
Okay, good distinction. What about chemotherapy? Does it have a role?
Chemotherapy is another option, though perhaps used less commonly as a primary treatment than surgery or radiation for meningiomas. It might be considered after incomplete surgery or after radiation, or perhaps if other options aren't feasible.
To try and slow things down.
Exactly, to potentially prolong survival or control growth. One oral chemo drug that's sometimes used is hydroxyurea.
How does that work?
It interferes with DNA synthesis, so it inhibits cell division. It has shown some effectiveness for human meningiomas, and it is used in veterinary medicine too. However, we don't have large-scale controlled studies proving its efficacy specifically in dogs and cats with meningiomas yet.
More anecdotal or based on human data?
Somewhat, yes. It's an option that's out there and used, but maybe with less robust evidence compared to surgery or radiation for this specific tumor type.
Okay. And what about just managing the symptoms if definitive treatment isn't pursued?
Right, palliative care. Medical management using anti-epileptic drugs for seizures and corticosteroids, like prednisone or dexamethasone, to reduce brain swelling can definitely help manage the symptoms and improve the pet's quality of life for a time.
Make them more comfortable.
Yes, but, and this is really important for owners to understand, these medications are not treating the tumor itself. They don't stop the tumor from growing. They just manage the consequences, like seizures or swelling, often only temporarily.
That's a critical point. Palliative, not curative. Are there specific nursing care things to keep in mind for pets undergoing treatment?
Definitely. Careful nursing is vital. For instance, we need to be cautious with intravenous fluids, not giving too much too quickly, as that could potentially worsen brain swelling.
Right.
Also, being gentle when handling the neck area, avoiding pressure on the jugular veins during things like blood draws, because compressing those veins can temporarily increase pressure inside the skull. Little things like that matter.
Good practical tips. Can we talk a bit more about the specific drugs used for swelling and seizures?
Sure. For reducing brain swelling, that vasogenic edema, corticosteroids are the mainstay. Often dexamethasone, or sometimes methylprednisolone initially.
Steroids.
Yes. In severe acute cases, like if the animal comes in with sudden worsening, we might use osmotic agents like mannitol intravenously. It helps draw fluid out of the brain tissue. Sometimes diuretics like furosemide are used alongside it.
Emergency measures.
Can be, yes. Hypertonic saline, a concentrated salt solution, is another option sometimes used instead of mannitol. Once the patient is stable, they're usually transitioned to oral steroids like prednisone or dexamethasone at the lowest effective dose, and then we try to gradually taper it off over time if possible.
And for seizures.
Anti-epileptic drugs, AEDs, are essential if the pet is having seizures. They're generally recommended for any animal with a meningioma that has had any seizure activity. Some neurologists even recommend them prophylactically as a preventative if the tumor is in the forebrain because the seizure risk is high.
Which drugs are common?
For long-term maintenance, phenobarbital is often a first choice. It's effective and relatively inexpensive. Other common options include zonisamide or levetiracetam Keppra is a brand name. Levetiracetam also comes in an extended release form, which allows for less frequent dosing.
And if they have really bad seizures, clusters, or status epilepticus.
For those emergency situations, we need faster-acting drugs. Injectable options like diazepam, Valium, midazolam, or injectable phenobarbital might be used. Sometimes a high dose of levetiracetam intravenously.
Okay. And the chemotherapy drug you mentioned, hydroxyurea.
Right. If that's used, it's typically given orally, often once a week, maybe every other day, depending on the protocol. The dosages are different for dogs and cats.
Got it. It sounds like a very involved treatment process, potentially using multiple approaches. What kind of follow-up monitoring is needed?
Close follow-up is absolutely crucial. We need to monitor how the patient is doing neurologically, of course. Are the signs improving, stable, or worsening?
Check their neuro status.
Yes. If mannitol was used repeatedly, we need to keep an eye on blood osmolality and electrolytes. With steroid therapy, we watch for improvement, which can sometimes be seen within 24-48 hours, but also monitor for potential side effects of long-term steroid use.
Like increased thirst, appetite, panting.
Exactly, and potential for infections or other issues. If the pet is on phenobarbital, we need to check blood levels of the drug after starting it to make sure it's in the therapeutic range, and then monitor liver enzymes periodically, maybe every 6 months, as it can affect the liver.
And with the hydroxyurea?
With hydroxyurea, the main concern is potential bone marrow suppression. So regular blood tests, specifically complete blood counts, CBCs, are essential to check white blood cell, red blood cell, and platelet counts.
Oh.
Usually before starting, then weekly or biweekly for the first month or two, and then maybe monthly or every couple of months if things are stable. We also watch for other possible side effects like GI upset, mouth sores, nail changes, hair loss, or difficulty urinating. The most serious potential issues are that bone marrow suppression and, rarely, lung fibrosis.
Okay, lots to keep track of. So bringing it all together, what's the bottom line? What can owners generally expect in terms of the course of the disease and the prognosis with these different treatments?
Okay, let's break it down by species. For cats with intracranial meningiomas, the ones in the brain surgical removal generally carries a very good prognosis.
Oh, good.
Often, 75 to 80% of cats are considered effectively cured with surgery alone. The reported average survival time is typically quite long, around 22 to 27 months.
That's really positive for cats.
It is. A couple of caveats. Seizures, if they were present before surgery, might sometimes persist even after successful tumor removal. And if the tumor does recur, it usually comes back in the same spot. Without treatment, or just with medical management, the neurological signs will eventually worsen, though it can be a slow decline in cats.
Okay. What about cats with spinal meningiomas?
For the spinal ones in cats, surgery is still the main treatment, but the reported survival times tend to be a bit shorter than for the brain tumors. Median survival times are often reported around 14 to 17 months after surgery.
Still potentially over a year.
Yes, but if only corticosteroids are used for spinal meningiomas in cats, the outlook is poor, likely leading to ventral paralysis and loss of bladder control.
Right. Now, what about dogs? The outlook sounds maybe more complex for them.
It is generally more complex, largely due to that invasive nature we discussed. For dogs with intracranial meningiomas, the outcome after surgery really depends on the technique and how completely the tumor can be removed.
What are the typical numbers?
Older studies reported median survival times around 7 months, with more basic surgical techniques. However, with more advanced methods like more aggressive resection, use of ultrasonic aspirators to remove tumor tissue, maybe endoscope-assisted survival times can be significantly longer. Some reports show median survivals of 16.5 months, or even much longer depending on location and completeness of removal.
So surgery helps, but maybe not always curative, like in cats?
Less often curative, yes. That's where combining treatments comes in. Adding post-operative radiation therapy after surgery have been shown to significantly boost survival times in dogs, with median survivals often reported in the range of 16.5 to 30 months.
That's a big improvement. What about radiation alone?
Radiation therapy as the sole treatment, using conventional protocols, typically yields median survival times of around 5 to 12.5 months.
Okay. And chemotherapy, hydroxyurea?
Chemotherapy with hydroxyurea, based on available data, seems to offer an average survival of about 7 to 8 months.
And the advanced radiation, SRS?
Stereotactic radiosurgery reports average survival times generally in the range of 16.4 to 19.8 months, so quite comparable to surgery plus conventional radiation in some studies.
What about just medical management for dogs? Steroids and seizure meds?
Unfortunately, for dogs with intracranial meningiomas, medical management alone has a poor prognosis. The average survival time is typically only around 3 months.
A stark difference.
It really highlights the benefit of definitive treatment like surgery or radiation in dogs.
And finally, dogs with spinal meningiomas.
For intraspinal meningiomas in dogs, surgical removal has a reported average survival of about 19 months. Adding radiation after surgery has a reported median survival of around 13.5 months in one study. A bit counterintuitive, might depend on case selection, but surgery is generally the primary approach.
It really does seem that early and appropriate treatment can make a huge difference, especially for dogs.
Absolutely. It really underscores how vital prompt veterinary attention is if owners notice any concerning signs, even subtle ones, in their pets.
Agreed. Early diagnosis and getting the right treatment plan tailored to that pet can be crucial for improving the outcome and, importantly, maintaining a good quality of life.
Couldn't agree more.
Well, this has been a really thorough deep dive into meningiomas in cats and dogs. Just to quickly recap, these are pretty common tumors, especially in older pets, coming from those protective layers around the central nervous system.
Right, the meninges.
The signs can be super varied, really depends on where the tumor is located. And while they're often technically benign, particularly in cats, they cause problems mainly through compression, through pressure.
Exactly. That pressure effect is key.
Diagnosis really leans heavily on advanced imaging, especially MRI, but CT is useful too. And thankfully, there's a range of treatment surgery, different types of radiation therapy, including that precise SRS, sometimes chemotherapy, and always supportive medical care.
A multimodal approach is often best.
It really highlights, as you said, how crucial it is for us as pet owners to be observant, notice those subtle changes in behavior, mobility, appetite, whatever it might be, and seek veterinary advice sooner rather than later.
Definitely. Early intervention can truly impact the prognosis and the well-being of our companions.
That's an excellent summary, and it really does show the significant strides made in veterinary neurology and oncology. There's definitely hope for many pets facing this diagnosis now.
There really is. The options are much better than they used to be.
It certainly seems so. And, it makes you wonder, with all this progress in neurosurgery and radiation oncology for pets, what might be next? What future breakthroughs could further improve outcomes for animals diagnosed with meningiomas? Definitely something to think about. Thanks so much for joining me for this really insightful deep dive today.